In this video, we're going to talk about ventilation and perfusion. So let's first define what ventilation and perfusion are. Ventilation is the movement of air in and out of the lungs. So we would typically just refer to this as breathing. So this is inspiration and expiration. The amount of air that moves during ventilation is regulated by the diameter of the airways. And what we mean by that are the things like the trachea stays about the same, but things like the bronchi and bronchioles have smooth muscle in their walls, and so they can actually dilate or constrict based on the amount of air that needs to be entering and leaving the lungs. Perfusion, which is abbreviated with the letter Q, so ventilation is V, but perfusion is Q, and I like to think of it as quantity because it's the quantity of blood. And more specifically, in this particular case, perfusion is looking at the quantity or the amount of blood in the pulmonary capillaries. And this can be regulated once again by smooth muscle in the walls of the pulmonary capillaries. And so essentially what happens is the body typically adjusts ventilation and perfusion so that they match up, meaning that blood is sent to the capillaries that are around the alveoli that are receiving air. The alveoli that are not receiving air are not going to get very much of a blood supply because there's no reason for the blood to go there because there's no oxygen to pick up and the carbon dioxide won't be able to be dropped off either. So essentially, your body adjusts as to how much air you need to bring in and out of your body, and that air does not go into your alveoli evenly, especially when it comes to things like if you have damage or disease or something going on with your lungs, parts of your lungs are going to be getting air more readily than other parts of your lungs. Sometimes, however, there is a mismatch between ventilation and perfusion. So remember, the V means ventilation. And the Q means perfusion. So there are times when the air is going to parts of the lungs that are not receiving an adequate blood supply, or the blood is going to parts of the lungs that are not receiving an adequate input of air. And this mismatch can be caused by anything that affects airflow and or blood flow. So airflow in and out of the lungs or to different parts of the lungs, or blood flow to those pulmonary capillaries. So these are some examples of different respiratory diseases and disorders that can lead to a mismatch between ventilation and perfusion. So things like chronic obstructive pulmonary disease, also known as COPD, emphysema, chronic bronchitis, asthma, pneumonia, and pulmonary edema, which is also known as lung congestion. So if there is a mismatch between ventilation and perfusion, here are some of the symptoms that an individual might encounter. So things like shortness of breath, wheezing, fatigue, chest pain, and cough. There are additional symptoms, but these are some of the most common ones. And here are some of the treatments that can be given to somebody that is maybe suffering from one of these diseases or disorders. So bronchodilators, these help to increase the diameter of the bronchi and bronchioles. So this helps to increase airflow. And this is something that would be in like an asthma inhaler. These are bronchodilators that help to relax that smooth muscle and allow more air to flow in and out of the conducting structures of the respiratory system. Steroids help to decrease inflammation. And inflammation oftentimes comes in the form of fluid. So it helps to decrease the amount of fluid that is maybe in the passageways or in the lungs. Oxygen therapy. So this is just to make sure that someone is getting more oxygen with each breath they take. So it's not necessarily fixing the problem, it's just making sure that there's more oxygen in the air that is getting to the lungs so that there's more oxygen needed to go into the bloodstream so the person can do cellular respiration. Antibiotics can be used to treat bacterial infections. And these bacterial infections can cause things like bronchitis and pneumonia. Blood thinners might be needed to help with blood flow, or surgery. And surgery might be needed in order to fix an anatomical problem that is preventing ventilation and perfusion from matching up.